I suppose this will not be the first time you would be listening to someone saying smoking is unhealthy. However, if we doctors were to have a practical approach to deal with patients, it is almost impossible to convince patients to suddenly stop smoking after a hair transplant. Some patients might think that switching over to gums or dermal patches would be good enough. It's not so. What they don't realize is that the culprits of slower healing process, poor graft survival, as well as complications like necrosis of the scalp skin, which is basically skin death, a topic that I have discussed in one of my previous videos, are not just the harmful chemicals released in the tobacco smoke. Both nicotine as well as carbon monoxide in the tobacco smoke play a role in giving patients who smoke poor hair transplant results. In this video, I will be talking about how nicotine and carbon monoxide play a role in poor hair transplant results, and I will also tell you how you could make the most out of your hair transplant procedure if you happen to be a smoker. Nicotine is present in all tobacco products as well as their substitutes like nicotine gums and dermal patches. These substitutes might help someone to eventually give up smoking in the long run, but they do not eliminate the local as well as systemic effects of nicotine. Nicotine is the main addictive component in all cigarettes. It is a potent peripheral vasoconstrictor, which means it narrows down the blood vessels, hence decreasing the blood supply to the scalp. In my previous video, I told you about how minoxidil is a hair growth stimulant as it is a vasodilator, which means it dilates the blood vessels and hence increases the blood supply to the scalp skin. So for better understanding, I would like to say that the effect of nicotine on hair growth is just opposite to that of minoxidil. Secondly, carbon monoxide, which is a byproduct of tobacco smoke, competes with oxygen to get dissolved into the blood. In other words, we could say that carbon monoxide is a competitive inhibitor of oxygen. This means that the levels of oxygen in the blood, which would later be supplied to the scalp, would be decreased. This leads to something known as tissue hypoxia, which is responsible for poor graft survival as well as slower healing process in smokers. Studies have demonstrated that as few as 2 cigarettes in a day could reduce the peripheral blood circulation by 9 to 55%. After clearly stating the facts, I believe nobody would want to risk a good hair transplant result. When a patient walks into my clinic, I ask them whether they smoke or not. If they do, I let them know about the facts and I also tell them how this could be a hurdle during as well as after the procedure. If a patient smokes around, say, 5 cigarettes in a day, a hair transplant can be considered only if they reduce this number to 2 cigarettes a day and also agree to completely stop smoking for at least 3 weeks, which would be 1 week before and 2 weeks after the procedure. Light smokers often do not find it very difficult to follow the doctor's instructions. However, on the other hand, those who are heavy smokers, that is, those who smoke 20 or more cigarettes in a day, find it easy to reduce this number to 15 cigarettes a day, but find it very difficult to cut it down to 10 cigarettes a day. As often, but not always, these patients lack the motivation to reduce smoking and are also at a high risk of reverting back to heavy smoking. A hair transplant procedure should be postponed till they have reduced this number to 10 cigarettes a day. At my clinic, I plan a hair transplant only after I've made sure that a person who smoked 20 or more cigarettes in a day, that is, a person who was a heavy smoker in the past or in the present, smokes no more than 5 cigarettes in a day and agrees to smoke no more than 2 cigarettes in a day for at least 3 weeks, which would be 1 week before and 2 weeks after the procedure. This can be achieved with the help of a psychiatrist who would handle the issue in a confidential manner and would also use modern medicine to keep the cravings at bay. Discontinuation of smoking at least 1 week before the surgery ensures that there is no excessive bleeding on the day of the surgery. Smoking affects the immune system of the body, and so smokers have a slower healing process as compared to non smokers. Also, smokers are at a greater risk of acquiring infections after the procedure. Additionally, you would also want to know that smoking is linked to something known as hypertrophic scarring. This means that smokers have a risk of developing prominent scars in the donor area at the back of the head. Let me end with a rather unfortunate fact. Smokers perhaps live very happily, but they just don't live long enough. So, this was all I had to say about smoking and hair transplant. I just want you to have a great hair transplant result, and I could also be wanting you to have a healthy lifestyle. If you found this video helpful, please like this video and also subscribe to my YouTube channel for more information about hair restoration and hair transplant. If you have any questions which have been left unanswered in this video, please feel free to drop a comment in the comment section below. It would be great to hear from you. Thank you for watching.